dysfunction between your right or left hip. Okay, on the FMS, you got a 3 or you got, and then you got a 2, whatever the case may be. How dysfunctional is it? And this is how it's going to tell you, right? So if you have right or limb length discrepancy on the lower body or the upper body, it's going to take whatever that ratio looks like and say it's either green, yellow, or red. If your knee is able to flex like a 90 and it's able to flex a 96 on the other side, what's going to happen is it's going to flag and say that's red because you've got 6 centimeters more of range of motion on one side loading up that one joint. Okay. Okay. And then same thing with the upper body. So there's lower limb length and then upper limb length, and I'm going to show you how to measure that because it's a little bit different. So the lower limb length is the top of the hip bone all the way down to the foot, and the upper limb length is the wingspan, but half of it, where we grab it from here and then all the way to the finger. Okay.
So like from the spine?
From the spine. I'm going to click new. This time we're doing YVT. Okay. So first, let's measure his limb length.
We want to, I don't remember how we did it last time, but no shoes?
No shoes.
Yep.
I usually try to go no shoes if possible with everything like that.
What I did when I did my first FMS, like the story.
So 104 for lower limb length. And then go ahead and bring both arms out from the side.
You mentioned it from the
Hip bone.
Yep, right on the top of the hip bone.
right on top of the
The press or the ASIS?
I go with ASIS.
Oh, yeah.
Yep.
Very talented guy.
So then I'm gonna probably go to this T1 junction. That's where I put my finger.
Okay.
And then we'll go. So it's a half measurement. Okay.
You have to, okay, you didn't just lift it down, okay.
Yeah. Half measurement. So it's 93, and then you have to multiply by 2. Go ahead, relax, CJ.
And that's going to apply from finger to finger?
Yes.
93 times 2, what is that?
186. It'll already do that for you. Sorry, you don't have to do that.
So you don't have, okay, I got you.
And it was 104 for his lower limb length. Okay. Now, with this type of test, you have to give the client at least 1 to 2 trial runs before you administer the actual test. They only do the test, yeah, because if not, since it's multi-directional, it's not that it'll be challenging for him body-wise and biomechanic-wise, but brain-wise, he needs to know exactly what he needs to do. For that, it's pretty straightforward. This one's a little bit more complicated. So if you're testing, okay, if you're testing his right leg, it's the leg that's actually on the box that's getting recorded. Okay, so he's going to test his right leg, so his right leg is on the box.
Right.
Now, yeah. Let me just see something real quick, because this is what I'll talk about. Let's just put that at 60.
Now what is this? What are the numbers?
Oh, see, that's what happens. You have to, we're going to write all this down, because if you saw what happened, I went in there to do 63, and it erased it.
Yeah.
Okay? And you will not be happy with yourself when that happens.
What are those numbers?
What's
apply? What are the 60, 60?
Oh, I'm going to show you right now.
Okay.
So someone get out their phone so they can kind of write this stuff down.
I got it.
So we're going to test the right lower body, and we need to write anterior, posterior medial, and posterior lateral. Okay, so TJ, this is what you'll do. And I'm gonna show him first, and you can practice a little bit of line test. So right leg is here, toes are there. Now, a couple things, you definitely don't want their heel lifting up at all, okay? If he does it excessively, I'm just gonna have him stop and record the test again. Number two is, when he pushes the box, he's aiming for the red blocks, okay? And I'll show you what I mean by that. So this is the first part of the test. The toe is pushing, 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 and then I'm done. You don't want the person to try to kick that even further. Okay, so I have them go super slow.
The toe has to remain on the red box.
Yes, so here's the test. So it's here. They don't touch the floor. The side of the box again.
Are we allowing flexibility if the foot does come up a little bit, like, you know, in terms of losing balance?
Just a little bit, yeah. So
What if their foot does touch the floor, they have to redo the whole test?
I would like them to.
Okay.
I would like them to. So anterior, posterior medial, and posterior lateral. So the last test you're gonna, Michael.
Do you want me to hold it?
Michael.
Has to be Michael's fault.
So remember, the last test you're gonna do is gonna swivel underneath of the body.
Yep.
Okay? So let's do that, because the left side is exactly the same, but of course you're gonna have to reverse the order on that, okay? And I usually try to put, so this one definitely is the hardest one, so you wanna put the block kinda close to begin with. So remember, you can't touch the white.
Right.
You're touching the red. And let's have your arms go out to the side for me.
Lost it down. Cool. Pretty good.
Not bad. I would have them probably not torque your body mechanics so much for that last one.
I gotta drop and not twist so much.
So
How close do you set up the box?
usually about there.
Is there any rhyme or reason to what number to set at, or just put it close enough?
Not at all.
Okay.
When we do the upper body one, it's got to be a little bit closer.
Yeah. Left side now?
No,
Or is that the
let's
right-
do
the right side?
let's go into a live test.
Okay.
TJ's, are your feet slipping on that thing because the socks are on?
No, I'm okay.
So make sure those toes are all the way to the front, TJ. Okay, when you're ready. Good, thanks.
Woohoo!
It'll pull it up between there
Yeah.
and there.
Right.
That one, not so much, but it's gonna compare the right to the left side.
Sure.
So that's irrelevant to you.
Yeah.
So let's score that down on the phone.
Can you just tell me right anterior?
So right anterior is 46,
Medial
100,
and lateral.
and then 90 for lateral.
Okay.
Okay, so. Okay, let's get a trial run on the left side for me. Okay, you're on your left knee and your right foot is gonna be on top of the box. And your heel's gonna be all the way at the edge. Back here? Yep. Okay, you're gonna sit up straight. Let's scoot your knee back a little bit. Okay. So now, he's gonna lean, so I would have your arms down to your side. He's gonna lean forward. Coming right there, stop. Because as soon as that he starts lifting up at his ankle. Now, I've got the level on my phone. I'm gonna put it right there. Is at 20 degrees. Okay? So right ankle clearing is at 20 degrees. Let's do his other side.
Right, he said it's
Right there. Left ankle, 25.
Is there any pain, DJ?
Nope. Just comfortable stretching.
Quarter each, 80.4 and 75.6, so we've got about 4 degrees off. Let's open it up posterior lateral reach. So there it is right there. It has him a grand score of everything, but then he's 10 centimeters off on the right side compared to the left. So high risk for injury there, if you were to go and do any type of sport movement, for sure.
So that was, which one that was? Right.
Posterior
That
lateral, yeah,
versus that one.
yes,
Okay. So this is the lateral.
yes. Okay.
Right and laterals there.
Yep, let's open up posterior medial, I just want to see what it looks like.
Oops, sorry. So it always just compares right and left in that same test. I see, okay.
No problem there.
So that was this one,
Yep, no problem there.
on the right side and the left side.
Mm-hmm.
Okay.
So the goal with our clients would be to minimize that difference and try and
All
make
greens,
it equal.
all greens.
Anyways.
Okay, so now you have this data, right? This tells you how really dysfunctional the FMS really was. Just because they scored a 2 and a 1, what does that mean? Now you know what it means, and now you can say, look, there's a big injury-inducing risk factor, so we have to get you better scoring here, and ultimately get you better scoring on the FMS, but they work hand in hand together, okay? There's no extra custom exercises to include on this one, but this is a good time to then maybe correlate and change the exercises or make them a little bit harder with the ones you currently have. Also, if you're testing a large group of people, I would then recommend using the Nord board from Valve Performance, which will be able to detect any type of left or right lower body asymmetry. Also, if you have a client that maybe can't get into some of the positions in the YBT balance test, they can do a moderate isometric hold on the Nord board, and you'll be able to see if they have any discrepancies in their strength and utilize some other testing criteria to check their mobility.